Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Hello and very good morning to you, dear viewer. Thank you for joining us for another episode right here on our Health Corner show, your trusted space for health awareness, expert insights, and conversation that matters to you as far as your well-being is concerned. And thank you very much for joining us. My name is Maureen Kimani, and today we have a very special guest in our studio here with us from St. Mary's Mission Hospital, and she will be introducing herself, and she will be shedding more light about a conversation today that is speech and language therapy. Today, as we get to understand what is it all about, so in case you are a parent, an educator, or a caregiver, and you're just curious to understand more about speech development, there's a conversation that you don't want to miss. So welcome. In case you'd love to be part of this conversation, please do not hesitate to reach out to us on 0717 424 866, or you can use the SMS number that is 21760. Welcome to the discussion. Very good morning to you, dear sister.
Good morning.
Good to have you here, and thank you for making time.
Thank you.
Yeah, as because it's your very first time coming here at Capuchin TV.
Yes.
Could you kindly introduce yourself to the viewers and tell us who you are and what you do at St. Mary's Mission Hospital?
Thank you for giving me this chance. I'm Sister Gladys Rotich, an Assumption sister of Nairobi, working at St. Mary's Mission Hospital as a speech and language therapist. Yeah.
Thank you very much for making time and for being here to help us understand more about a conversation today. And just to begin with, for a person who's coming, into contact and across this conversation and topic for the very first time, because I'm also curious to know what is it all about when you talk about speech and language therapy, and perhaps you can tell us what does a speech and language therapist do?
A speech and language therapist is a trained professional who provides care, treatment, and support for children and adults who have difficulties in communication, in eating, and in swallowing. Yeah. Yes. So it cuts across its children and adults. Yeah.
And what about when you talk about speech and language therapy? What about that? What is it all about, and what does it take?
I give an example of this is somebody who is not able to communicate because of stroke. And this person's language is affected. So, at first one is given a speech and language assessment to assess how far it affected the language part of the person. So there is first session, which is assessment, and now suggested activities to be done, to be given approximately, let's say, for once in a week. And it is done weekly for like a period of 12 weeks, so that in the 12th week we review to see if the person is able now to communicate, or what is the difference between day 12 and day 1 in ability to communicate, ability to express one's needs. Yes.
Okay.
Yeah.
So could you refer this to as stammering or stuttering?
Yeah. Speech and language, there is speech difficulties and there is language difficulties. For the cases of stammering, it's under speech difficulties. So the person has a problem. Instead of saying chakula, the person would say chakula. Yes. Yeah.
All right. And perhaps you can tell us the difference between speech and language delay and a speech and language disorder.
Yeah.
What is the difference between these two?
There is speech and language delay. I would literally use the word the person has delayed. There is one learning language, I give an example of a child may start babbling, trying to communicate. After babbling, they speak one word, playing mama, baba, chakula. Then 2 words, nataka chai. Then 3 words, nataka kula ndizi. So it is from babbling 1 word, 2 words. But you might, babbling is 6 months approximation. 1 word is approximation. By 1 year, a child should be speaking 1 word for a sentence. By 2 years, approximation of 2 words for a sentence. If a child is 3 years and speaking 1 word, which was supposed to be done in 1 year, that is a delay. The language is following the usual order. Maybe this child babbled and started speaking 1 word, but has taken too long speaking 1 word without moving to 2 words. So there is a delay. But that child is following the usual order of babbling, then 1 word, 2 words. For a disorder, you might find one has babbled and spoken 1 word instead of, and you realize instead of moving to 3 words, even the 1 word is disappearing. And even the babbling is not there again. Of course, they babble fast. And you might find this child saying, I need food, but not knowing what that one is. I need food, those are 3 words, but again, cannot tell what food is and what I need food is. So there is a disconnect. So using the word even disorder, it is not now from 1 word to 3 words. It's like you can say 3 words or 1 time 1 word, and that child might not even repeat. When you say, okay, you say, I need food, they will not say it again. They've just said it, and they might say it again after 2 months or 3 months. So there is no order. So that's how we sort speech-language delay and speech-language disorder. Yeah. In speech-language therapy now, we are sorting. If there is a delay, we do a lot of therapy activities to improve this delay so that this child is able to communicate like any other child of their age. If there is a disorder, we now try to bring the order of first even saying 1 word, and that word which they say they understand what it is, before even moving to 2 words. Yes.
All right. And I'm just curious to know, what is all the cause about this? Is it a genetic thing, kind of? How would you say, how would you describe it? What causes all these a speech delay exactly?
Issues. It's like, what are these things which cause a problem in communication? I give, there are primary diagnosis given. I give an example of somebody who is born, who is stammering. So the primary diagnosis is stammering. So if one is stammering, then they will need to improve their communication is now in undertaking speech and language therapy. That is one among the other cases. Another person is unwell, diagnosed with Parkinson's disease. Having Parkinson, the voice is affected. At times it is low. So that person would need a speech language therapist to improve the voice, to speak in a level that the other person is able to understand. There is this other person again, because we are talking of the causes. A person gets a stroke. So when stroke happens, again there is this operation of the, and it affects the language part. So you might help the person now to differentiate, for example, domestic animals. The difference between a cow and a cat, they might not be able to tell because the part of language was affected. So stroke is among the other causes. A child can be born with a cleft in the lip or in the palate, cleft lip or cleft palate. that child will not make articulate
Some of the words.
Yes, those are among. There are these children with cerebral palsy who are still drooling. They might not speak clearly because they are still drooling, so they will need a speech and language therapist. Yeah, and nowadays stroke, by the way, is not only in adults. Of late, I'm even attending to children. I had last year a grade 6 boy who had a stroke. Yeah, so it can be a stroke, it can be cerebral palsy. We also have children born with Down syndrome. Those children again will need speech language. We have children who are many nowadays, autistic children. Yeah. Yes. Yeah. So for now, we are not even discussing now what causes autism, what causes stroke, but those are the cases who will need now to communicate, and they will need a speech language therapy.
Okay.
Yes.
Yeah, and sister, you've been able to mention about the most affected group of these speech and language therapy. Our kids are mostly, but when you talk about some of the aged group member in our society, the fact that you mentioned that stroke can affect a person to have these delays. What about age? Because sometimes you find a person was speaking very well when they were very younger, when they were very strong, but when age just kicks in, they start having this problem of communicating. Could it also affect, or could you categorize it as part of this disorder or delay?
You mean somebody not speaking now the way the person used to speak?
Yes.
Because there is need to check first what might be causing it, not necessarily because of age. Maybe there is an underlying condition which is yet to be. That's why occasionally, especially with the adults, we have to work with the neurologists. What might be causing this to delay? Because maybe there is some Parkinson's. There is something again we call dysathia. But that one is to be diagnosed first by the neurologist, which might be leading now to this speech not being clear.
Okay. All right. And when we have this conversation, I'm sure just in every other health issues, we talk about some of the signs that people might be able to observe themselves, and even as a parent who is having a child at home or even a caregiver, what are some of the signs and symptoms that they should definitely pay attention to, and how long should these prolong so that they can also seek medication or seek some help in hospital, for example, at St. Mary's Mission Hospital?
You're right. What are the early signs? It is again interpreted on what has caused it. I'll give you 2 examples. If a child is autistic, what are you to check so that now you seek for the help in speech and language therapy? You'll realize the child is comfortable playing with toys but not playing with people. They like to play alone. When you provide toys, they play alone, not with other children. This child, again, maybe there is limited eye contact. Yes, they will see maybe a second and turn. This child might be repeating words. When you ask, what's your name? The child repeats the word, what's your name? Where are you going? They'll repeat, where are you going? Yes.
But some kids, they normally try to joke with their, elders. Yeah.
Because you are to add up a number of things. One, if there is limited eye contact, and this child likes playing alone, and apart from repeating what one is saying, giving instructions, by the way, go and bring me a spoon from the kitchen. The child doesn't know what that is. That is another indicator of. And most of the time, again, it is nonverbal. This child used to speak at 1 year, and 1.5 years, the speeches, the mama word this child used to say is no longer there. That is an alarm. So that is only in the cases of autism. That's why I'm saying it depends on the cause. When a parent notices that, and there is normally an instinct a parent finds, noticing that, oh, my child is not communicating, then the child of so-and-so is busy talking and making a lot of noise, yet we gave birth at the same, their age mates with my child. That is enough alarm. You seek help. Yes. So don't say, let me wait. So long as you have noted, there is something different. And the different somethings is this one now I'm saying, playing alone, little limited eye contact, and repeating what you are saying. And again, realizing this child is not speaking like any other child of the same age. That is enough. You act and seek help from a speech language therapist, but not saying the child will speak when they go to school. The more you delay, the more we are making it take time before it is helped. Yeah.
Okay.
Yeah.
And perhaps you can tell us, because I don't know where Kenya we are as far as this conversation is concerned. And being an expert at St. Mary's Mission Hospital, how have you been relating with these parents and, of course, these the caregivers? What is the number in our country? Do you feel like we have already made a lot of creating awareness to this conversation? And do people really understand speech and language therapy to begin with?
You're right. There is limited knowledge. That's why I'm happy being here in the Capuchin TV, so that the more people come to know, the better. Yes. We are few in the country. That's another thing. I was checking yesterday in the website. There is Association of Speech Language Therapists, Kenya. And I was able to note we are only 30 who are registered speech language therapists in the country. So that posts limited awareness. Yeah. And it is not only new in Kenya, it's also limited in Africa. Because where there are a number of speech language therapists only in South Africa, in Africa. Otherwise, we are still few. So many parents do not know, many teachers in school do not know, and again, even in the medical field, yes. Though in the few hospitals I have worked with, we interact, and neurologists come to know now, and especially in cases of stroke, and they are able to refer. When apart from helping the person to heal after a stroke, they realize again, because this person is not able to communicate the way they used to be, then they refer to a speech language therapist. So there is limited information in the country. Yeah.
So you think something should be done about that?
Yeah. Because it's my prayer, it's a dream, that it would be so good if speech language therapists have access to, I'm not talking even of grade 1, I'm talking of schools, even the level of PP1. If there is a screening of children at that level, PP1, that helps a lot in school going, because the earlier it is done, the better. Yes. It's important again for parents to know, like these early signs I'm mentioning, most children I access are those who are 6 years, 5 years, which is very late. This was supposed to be done at 2 years or latest 3 years. But most they take action when it is late. So that is the limited information, because at times they have no idea. Yeah.
Okay. Well, thank you very much, sister. And what a very enlightening conversation we are having here. And I understand on the month of October, on 22nd, we normally have this activity of creating awareness as far as the conversation is concerned. I don't know how a country, is going with this, and perhaps this year we can have something even from St. Mary's Mission Hospital just to create awareness as part of a continuation of this conversation.
That's good. That's good.
All right.
Yeah.
And what are some of the myths and misconceptions that surrounds this conversation? Because as much as you mentioned that there is a lot of information that needs to be, put out to the community and to our society, there might be some misinterpretation about language and speech therapy.
Narrowing it down to, because I interact a lot with parents.
Yes.
Autistic cases. Why I'm passionate about autistic in this discussion, when I assess like around 150 who are in need of speech therapy, it's like 50 of them are cases of autism. So part of the signs is the child was speaking at 1 year, and at 1.5 years the speaking starts regressing. So the misconception is a parent would say, it's because there is a visitor who's visited, there is so and so who came to my home. In my child started failing to speak and reducing the words, which the vocabulary, when so and so visited. Yeah. Or I had visited a particular place, yeah, and so they think kuna mtu aliona mtoto wangu na macho mabaya. Yes, thinking something happens, but I tell them it has nothing to do. It's part of a characteristic of an autistic child, that speech regresses, and most of it we see it at 1.5 years. Yeah. Some again say they ate a lot of eggs when they were expectant. Oh. Yes. And that's why they gave birth to somebody who is stammering. It has nothing to do with it.
These eggs is healthy for pregnant mothers.
Yes. But there is nothing like that. Yeah.
Okay.
Those are the only two I can give for now. Yeah.
All right. And you mentioned, just to take you a little bit back on what you had just said about early intervention. What is the impact and the causes when a parent doesn't maybe pay attention to their children and how they are developing as far as the language and speech is concerned, and they don't come to the hospital? Can it affect their future? And how long does these lessons and therapy sessions take?
The earlier intervention it is done, the better. And if it is a young child, it is good for this to be handled before the child starts going to school, before 4 years. That would be brief explanation. So the earlier one attends speech and language therapy before 4, the better, because it will solve the problem of school, because teachers will not understand this child. And you will find a child who is 6 years who has gone to like 6, 7 schools, different schools. So when we solve communication before age of going school, the better. And this child will end up learning like any other child. But when it is done late, it is bringing a lot of stress, not only at home, even in school. And because it will take time for them to catch up with how to communicate, because communication is the key. Yes. So I've had a case of somebody who is 16 years attending speech language therapy for the first time. So remember, we are handling to learn about domestic animals, and that is 16 years. So when we learn about domestic animals, we go to utensils. We need to know about the clothing we wear, which one is a jacket and which one is a t-shirt. That's knowing it and applying it. Give me 2 spoons. This is a child who will say 1, 2, 3 up to 100, but doesn't know what is 2 cups. So the numbers, it is only cramming. So remember, we are sorting a 16-year-old now, and when will they now start doing grade 1 work, grade 2 work, and we are talking, yes, so it becomes more complex, but it is never too late. But it is good, the earlier it is done, the better. Though it is tricky again, you will find them, it's because they didn't have knowledge of speech language therapy. As I tell you, we are few and to access. That's why this forum is so good for them to. Yeah.
And how long does this therapy session go for?
A therapy session takes 45 to 1 hour session. And during the first day, it might take more than 1 hour, maybe 1.5, because of taking the history and the rest. And the speech language therapist agrees with the parent now or that adult of the frequency. It can be done once in a week or twice in a week, depending on the severity. But generally, after 3 months, it is enough to review to see the impact. How is it now compared to how it was in day one? And after these 3 months, it can be reviewed again to adjust the frequency, maybe once in 2 weeks for the other 3 months. So it is roughly 6 months we are able to see a big difference in the progress. Yeah.
All right.
Yeah.
And I loved that you brought up the issue about kids not differentiating. These are 2 cups. They just know how to count. But if you give them maybe some props, they cannot be able to differentiate. So we appreciate that we have now CBE. They can be able to have tangible thing. So when we come to technology, it has really improved. So how do you see technology evolving as far as speech and language therapy is concerned for this conversation?
Day one recommendation, if it is a child, I normally recommend 0 screen exposure for the next 3 months, which is very complex in the current scenario and media. Why it is both good and not good. If we expose early, I need this child to know what a hen is. I need this child to know what an egg is. So I need this child to interact with an egg and we break it and see it being fried. I'm talking of food items before the media. So I would be comfortable. This should be general information of. At 0 to 2 years, it's advisable for language development, 0 screen exposure. And from 2 to 4 years, it would be 30 minutes exposure. And those 30 minutes, it's me and my child, and we are discussing this which we are watching. Not them watching and I'm washing the dishes. No, it should be we are discussing about it. By the way, it has delayed a lot. It leads now to a lot of language delay. Yes, yes. The language delay is because they are only, remember the media, you'll only see and they'll not wait for you to talk. You are only feeding the brain, but you are not given a chance to practice it and to apply it. Yes, so they'll be only talking exactly what they have watched, even accent is exactly what they have watched, but not using it to communicate. Yes. Because this child, as I said, saying 1 to 100, but at home now cannot give you 2 cups. So we are making it now. Yes, it is watching that which is of their age, but with the adult discussing it, what it is. It is tricky, but for parents who have applied it and when they come to therapy sessions, they are able to see the difference. Yeah, it helps a lot.
So it's working.
Yes.
Okay.
Yeah.
And you know, I'm just trying to understand and to think how devastating it can be being on the spotlight and actually you see you're having a problem in constructing a full sentence by not repeating yourself or even saying it more than 2 times. So I don't know, what is the stigma that surrounds these people? Because sometimes you find that when a parent understands and knows that my child has this issue, you don't want to expose them to other people. You just keep them separately. And you mentioned that it is better to just let them have a conversation with other people, other children, so that they can be able to learn and develop a very nice speech. How does the stigma surrounding these people and children and parents, how does it have effect to them?
It affects them very negatively. Giving an example of us in the Catholic Church, of a parent who came to me saying, "Sister, it's 2 months now since I attended church because my autistic child walked near the altar and it was during Mass and I was, a CWA lady told me, no, why are you not giving you are not training your children, your child is not disciplined." That really annoyed this parent. So All is because of they lack information. I miss forums where we have meetings with CWS, CMS. The more they know about these conditions of these children, the more stigma is solved. Yes, and they'll be able to accommodate them in the church, and they'll be comfortable. There is much which is being done slowly in schools. But we need to do a lot again in the church of accommodating them. Not only the children, let's think of these cases of stroke. Somebody is nowadays at home not able to attend mass because of mobility issues. How often do we plan to visit as a jumuiya and have mass in the homes of such people? And again, educating it is an advantage to the parish at large to learn what is a stroke and how is it affecting the person's ability to communicate. And so there is a lot of knowledge needed even in our church settings. And they react and they hide their children simply because us who are outside, we have not yet understood and not accommodating them. Yeah, because an autistic, when the instruments are being played, there is one who will close the ears, not wanting the noise, and they run out. So being allowed to call is okay because they feel it's like their ears are going to break. Being allowed, it is not indiscipline, but they are trying to balance because it is a sensory issue. When they go out and the songs are now calm and there is no singing, they come in, that should be allowed so that they understand. Yeah.
Especially sometimes the autism children, sometimes they tend to be very agitated so fast.
And when
very
they are
fast.
agitated, there is something which has triggered it. There is something which they don't want. Yes. Yes.
Okay. Yes, sister, go ahead.
It's a part of communication. It's like, I give an example of instruments being played. They will close the ears, which it would be an issue we discuss how is it to help. There is something, the way we have earphones, there is a particular one which cancels the sounds, which should be provided to that child. And when they put it, the sound becomes calmer. Yes, and they're able to accommodate.
All right. And sister, I wanted to ask you, when you're having this therapy session with the children, and of course the parents are present during that moment, sometimes you find that kids are very sensitive, to be very honest, and you find some parents, they might have a trauma of their past, and they have the issues with the economy perhaps right now. And you find, do you have a therapy session with the parents on how to be very patient with these kids and just to take them through very politely, nicely? You don't have to raise your voices. For example, you mentioned about the autism cases where you have these, you play this loud music and they just, block their ears. Do you have any kind of therapy with also the caregivers and the parents just to explain to them, please be patient, because it might affect the kids as well if you don't understand?
I do have. I do have. In the parents who come, there is a WhatsApp group I've created for those parents, and occasionally we have meetings once in a month without their children. They come and sit and we share. In fact, we originally wanted to be doing it for 3 hours, but we realized when we start at 9 in the morning, we will only be surprised to check it is 5 p.m. They have so much to share, and in their sharing, it's helping. It's very positive. They're able to understand it's not me alone who is going through this, and they're able to learn from the others, the other child, the other parent whose child has improved, that, oh, so I can try this and this. Such forums are very necessary than even speech language therapy itself, because they'll not be able to apply that if they have not yet accepted and they don't know what to do. Yes, so they are very important and it helps.
All right. Right, and perhaps we have a parent or a caregiver who's following this conversation, and they're just curious to understand how can they visit St. Mary's Mission Hospital, and they're looking for the best services. Perhaps you can tell us when can they come to the clinic?
Yeah, right. I'm in St. Mary's Hospital here in Langata every Monday, Tuesday, and Wednesday. Thursdays and Fridays, I'm in Nakuru. There is St. Mary's Nakuru Town Clinic. So those again who are coming, yes, not Elementaita, Nakuru Town. There is a Nakuru Town Clinic. Okay. Yes. So I'm there. It's good they have my number. Yeah, maybe I tell them.
Yeah, because I can also get my director telling me they are already asking for your number. How they can get in touch with you.
0722 56 76 76. Sister Rotich. Okay. Yeah, because when they ask for speech language therapy, they'll get me direct. 0722 56 76 76. Yeah.
All right. Lastly, as we went up with this conversation, and first I want to appreciate and thank you for making time and for sharing those beautiful insights about speech and language therapy. Yeah, actually, it's the very first time we're having this conversation. We should be doing it more often. And looking forward to the month of October, where we have creating awareness of the speech and language therapy.
Just to cut you short. October, we normally have International Day for Persons Who Stammer. It is for stammering. It is for stammering.
But it's almost the same. Close to that line, because it's all about communication.
Yeah, it is under. It is under speech language. It is in fact very particular. I talked of speech and language.
Yes.
Stammering is under speech. Yes. Yeah.
All right.
It's good. You'll have one who stammers to come to tell us.
Oh, okay. We're waiting for that.
Yeah.
So perhaps you can give a piece of advice to a patient, to a parent, to a caregiver, to relatives who are having these persons in their family and in their community. Perhaps you can tell them something on how to continue taking care of these children, and to continue loving them and supporting them in everything that they do, and the need for getting to the hospital to seek help. About that.
It's true. Number one, these parents who have children who need speech language therapy, to be patient. Yes, they have my number. It's good. Every minute, if it comes to you, you realize, this child needs speech language therapy, has delayed to communicate. Look for a speech language therapist. That is the first thing. Number two, if also you are attending speech language therapy sessions, please have time as a parent to be with your child, to play with your child for at least 30 minutes in a day. That helps a lot in interaction and in improving communication. Let's minimize screen exposure and buy as many toys as possible for children to play with, including sand. Children playing with sand, it helps a lot in sensory processing. Again, these adults who might need speech language therapy, cases of stammering or cases of stroke, seek help from speech language therapists. You check online on the website, because apart from me, there are other 30 plus speech language therapists in different parts of the country. Association of Speech and Language Therapists Kenya, they are able to access all our names and the email addresses, and you can get help. And remember again, apart from physical therapy, despite the distance, it's possible online, especially when handling adults. Speech and language assessment can be done online despite which part of the country or the world you are in. It's possible through Zoom. And you can get help. Okay. Thank you.
Wow, and may God continue blessing you, because we've had how you normally move from one point, there is Nairobi, all the way to Nakuru to help even these parent to help and assist and support the kids. May God continue blessing you and giving you good health to continue serving the community. Yeah, and once again, sister, we have a viewer who is asking for your number again. Could you kindly just look at that camera and repeat your number kindly one more time?
It's okay.
Yeah.
0722 567676. 0722 567676.
Thank you. That is Sister Gladys Rotich, who is a speech and language therapist at St. Mary's Mission Hospital. And we've really had an eye-opening conversation about speech and language therapy. I hope you have grasped a little bit of information, and make sure that this conversation doesn't end here. You continue spreading more information and helping these people in the society who have these children, or even an adult who might need this help to ensure that they reach out to Sister Gladys for these services. Thank you very much for joining us on our Health Corner show right here on Capuchin TV. My name is Maureen Kimani. See you next time, same place. God bless you.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.